Hello, my name is Robin Carter, and I'd like to talk to you today about communication. The article I'm using is titled Core Communication Competencies in Patient-Centered Care by Anita Boykins. The focus of the article is to provide core nursing competencies for effective communication and to discuss tools used in patient-centered care, interprofessional collaboration, and informatics. So, what is communication? It is the creation of meaning in communication in which patients and healthcare providers exchange information so that patients are able to actively participate in their care. It is a two-way process of expressive and receptive communication so that the message and the responsibilities of both the patient and the healthcare provider is understood. Some of the core competencies discussed in the article include to provide clear, concise, written, verbal, and electronic information, to apply principles of active listening. The nurse must be knowledgeable and understand the physiological, the psychosocial, developmental, spiritual, and cultural influences on communication. We need to choose the right setting and the right time to communicate and assess the patient's ability to communicate. We need to also be able to assess barriers to effective communication and then make appropriate adaptations for those barriers. We need to assess the verbal and nonverbal responses and finally be able to distinguish between effective and ineffective communication with patients and other healthcare providers. So when we use communication and when does it need to be effective? Well, for nurses, that means all the time. We need to be clear and concise. But three areas that are especially important for nurses to use effective communication is during medication safety. When we're communicating with patients and families, it is extremely important that we get clear and accurate information so the patients are kept safe while we give medications. Two other areas are during the shift report handoff and also when we're communicating with physicians or other healthcare professionals. One tool that is especially important for nurses and very useful for them is the SBAR technique. And that stands for, it's an acronym, and it stands for Situation, Background, Assessment, and Recommendations. And it's just a way to help the nurse make their thoughts and get their thoughts in order and organized to be able to give accurate information to the person they're communicating with and to help be an advocate for their patients. As nurses, it's important to know our verbal and nonverbal cues, but it's also important to understand information technology, as this form of technology is using emails, texting, and sending private information, personal information to patients and other healthcare providers. It is important that we know how our patients communicate because some patients may not have access to computers. And if they do have access to them, they may be technologically challenged. So if we're aware, we can make sure that we're giving the right information, the right form of information to our patients. And also it's important for nurses to know about and be understanding of the health information privacy laws so that we are maintaining our patient confidentiality. So in conclusion, it is imperative for nurses to be skillful in communication techniques, to ensure patients are able to participate in their care, and that the message the nurse wants to convey is clearly understood. By becoming good communicators, nurses will improve patient outcomes and deliver high quality and safe patient care. Thank you for your time.